welcome everyone. Thanks for joining this webinar today. It's hosted by the Dissemination and Implementation in Diabetes Research Core at the WashU Center for Diabetes Translation Research. We're really excited you're here. I'm really excited to be attending this webinar and learning more about the tool. My name is Rachel Tabak, and I'm an associate professor at Washington University, and one of the core co-directors for the I'm going to say it again, the Dissemination and Implementation in Diabetes Research Core. Our core aims to accelerate the application of advanced methods in D&I science, enhance the impact of web-based D&I tools and resources, which is what you'll hear about today, and build team capacity and skills essential for D&I of diabetes translation research. And if you do want any other follow-up from the core, just let us know during or after the webinar. Today, we're really excited to be hosting Dr. Maura Kepper, who will be presenting on the Designing for Dissemination and Sustainability Planner, an interactive web-based planning tool. During her talk, she will highlight the new tool and how you can maximize the impact of your project using this new planner. A few things, I think Shelley might have said some of them, but just in case. So we will be recording the session today, and that recording will be available on the CDTR website. There's a section, I think, that's called recordings. If you do have questions during the session, I'll be reading those in the chat, or I'll be following those in the chat, and then we will have a Q&A section at the end. And during that session, people will be able to unmute and turn on their camera and ask questions, as well as putting them in the chat. I will go ahead and introduce Dr. Kepper. Dr. Kepper conducts research to reduce the burden of the social, economic, and environmental conditions that shape the health of individuals and communities. Her research combines expertise in behavioral medicine, informatics, and implementation science to design, evaluate, disseminate, and sustain interventions that overcome community-level barriers to reduce health disparities in childhood obesity, cardiovascular health, and other chronic diseases. Dr. Kepper is an assistant professor at the Brown School at Washington University in St. Louis and a member of the Prevention Research Center. Prior to joining WashU, she completed postdoctoral training at Pennington Biomedical Research Center in Baton Rouge, Louisiana, and her research has been funded by the National Institutes of Health, the American Heart Association, and Blue Cross Blue Shield Foundation. Thanks for your presentation, Maura.
Thank you, Rachel. Really excited to be here today and share this new tool with all of you. I see some familiar names, but also lots of new ones. So excited to dive into this relatively new area to D&I and talk with you all about this. So we call this the D4DS Planner. So I'll start there. You're going to hear me say that quite a bit. And D4DS stands for Designing for Dissemination and Sustainability. So what is D4DS? Probably a really important place to start this talk. There are kind of four key components to D4DS. The first is that we're beginning with the end in mind. So we're not waiting to the end of our project to think about things like dissemination, how we're going to implement in practice, but we're really thinking about that from the start. The second is that we're being sure that our product fits the context in which it will be implemented, and that we're planning for dissemination and sustainability in the early phases of our project or in the early phases of our work. So in other words, we don't want to wait until we get all the way to the end of this kind of odyssey, this very famous 17-year odyssey, to consider how your research will translate into practice and generate impact. So D4DS really asks you to think about this from the start, and it provides you opportunities to adjust and adapt along this process to ensure that your research generates impact. So I'm going to give a couple key terms that we're going to be talking a lot about today. You may already be familiar with these, but I want to just be sure we're all talking about them in the same way. So dissemination is really, in our case, defined as an approach of spreading evidence-based products and interventions to the right people or our intended audience via determined channels using plan strategies. And really, the D4DS approach focuses on ensuring that these channels and strategies align with the needs and preferences of our audience. We're also focused on sustainability. So this is the ability to maintain an intervention and its benefits over time. And then equity is also a key part of the D4DS process. And we're defining that as having a fair and just opportunity to be as healthy as possible. So D4DS may promote health equity by developing effective interventions and products that meet the needs of historically marginalized populations, and using dissemination strategies that make these effective interventions equally accessible in their context to generate equal opportunities for health. I want to acknowledge right out the gate that D4DS does not address the scope of obstacles that these populations face, like poverty, discrimination, powerlessness, quality education, and housing. Yet we really think that based on evidence from community engaged research, using this D4DS process with equity principles in mind has the potential to promote health equity long-term. So a key part of the D4DS process is prioritizing the needs and perspectives of potential users, recipients, and decision makers at every stage of our research. And through this process, it's important that we consider a diverse range of perspectives. So we don't want to simply engage the recipient or the implementer, but we also want to think about all the other people who may influence them. So decision makers, funders, policymakers, even those people who may not, who may sabotage the use of your product. So what you're seeing here on the screen is called the 7 Ps framework for stakeholder engagement and outcomes and effectiveness research. And this is really a helpful starting point to consider all of these different people. So it has patients and the public, providers, purchasers, payers, policymakers, product makers, and principal investigators or researchers. And this is a nice example, actually, in hypertension and diabetes prevention research on a really nice paper that describes kind of lessons learned from their engagement process. Another key thing to consider as we decide who or who not to include is to be sure that our choices do not create, reinforce, or maintain existing inequities. So oftentimes, it's really important to consider who is not included versus who is. And there's a wide range of engagement levels. So depending on the needs of your project and what is feasible, you may choose to engage partners in multiple different ways and with differing levels to support your design, dissemination, and sustainment of your product. However, we really want to encourage you to move away from more contractual agreements where partners are really just providing maybe a site for your research. Rather, this is about engaging them in a more collaborative or collegial way where there's power sharing, where there's shared decision-making, where there's engagement over time rather than more of a one-off consultation. You've probably also heard of a wide range of terms used when we think about engagement. So community-based participatory research, community engaged research, or participatory design. But really all of these focus on engaging community in an iterative and ongoing manner. And they all focus on co-producing knowledge, interventions, policies, or systems changes. What I think D4DS does and builds on those methodologies is it also focuses on engaging them in the dissemination and sustainability of your product. So the key framework in D4DS is called the Fit to Context framework. And this really aims to support research product adoption, sustainment, and equitable health impacts. So it has 4 phases in this framework: conceptualization, design, dissemination, and impact. So in your conceptualization phase, the objectives here are to establish partnerships, to identify relevant evidence, and assess the context. And the goal here is to establish a need and demand for your product or your innovation, as well as an understanding the capacity for change in that context. In the design phase, this includes co-designing your product, and also planning your dissemination and sustainability plan. The idea here is really that we're generating products that are feasible, that can be implemented, that are acceptable, useful, and equitable to our intended audience, and that dissemination and sustainability plans align with our context and our intended audience. All of this happens before we move into active dissemination, where we're striving to increase awareness, intention to adopt and sustain, and promoting equitable access to our products. The last phase is really examining whether the research product is adopted, implemented, sustained, has impact, and on broader health and health equity. So you see here that the conceptualization and the design phase is outlined in red, and that's because this tool really helps you or users of the tool operationalize those first two phases of the framework. So the conceptualization and the design phase of the fit to context framework. You've probably heard me say product and innovation multiple times. And so I want to define that for you because that's really the term we use in the tool. But really a product is anything that we learn or create from doing research. So this may be an intervention, it may be an evidence-based practice, an innovation, a technology, it could be a research finding, evidence, a policy or guideline or a method. And for the purposes of our tool that I'm about to introduce, the research product is really the thing that your team is trying to disseminate and sustain. So our goal was to develop a digital platform that helps healthcare or teams conducting health-related research that includes academics, practitioners, and community partners. The goal of the tool is to help them learn about D4DS, the principles and methods of this methodology, and operationalize the fit to context framework. Ideally, we're having teams use this tool at the beginning phases of their project. However, we did design the tool where you could come in at any phase of your research. So maybe you're already kind of through a big chunk of your research project and you're moving into dissemination. You could come in at that point of your project and just use the tool to develop a dissemination plan. But the goal really is to get you thinking from the beginning phases of your work about these concepts. Ooh, sorry about that. So to design this tool, we engaged end users and an expert panel in a mixed method participatory design process. We used human-centered design methodology, and this really starts all the way from discovery to design to testing. We utilize common design principles throughout this process. So we were really intentional about being person-centered, communicating both visually and inclusively. We collaborated and co-created this tool with our end users, and it was very much so an iterative process. So really you should see arrows returning to all of these steps rather than just one going straight across. So in our first design session, we understood the need and demand for key issues this tool could address for researchers like you. So we had them come in, they brainstormed potential features, and really these fell into 5 categories. They wanted methods and tools, they wanted grant proposal resources, dissemination resources, educational materials, and then they had just some kind of general design and format ideas. So from this session, we came away with 35 different things we could do in this tool. And of course, as a team, we then had to think about which ones are most important. And we kind of combined similar features to generate a final list of 25 features that we then took back to the end users and asked them how they would feel if that feature was in the tool and if the feature was not in the tool. And this is called the Kano methodology. So using this methodology, it classifies features as the users must have it, meaning they expect it to be there and they would be dissatisfied if it wasn't in the tool. Or it was one-dimensional, meaning they expect it to be there. It could be attractive, like they like it if it's there, or they're indifferent about it. So the list you're seeing on the right is actually the 13 features that ended up in the tool from this list of 25. We only had one feature that was a must-have feature, and we had most of our features fell into that attractive category. But you can see we included links to other resources, and you're going to see a lot about this first one under the attractive feature list, which is a step-by-step guide, or what they were calling a roadmap on how to do D4DS. So our next 3 design sessions, we really focused on iteratively envisioning and creating wireframes of features that were prioritized in those previous design sessions. So we were drawing with our end users, they were giving us feedback, and we'd come back in our next session and we'd iterate on that design and improve it. So the images you see here are an example of how we drew out and kind of iterated on that roadmap for how to walk through the D4DS process. And we started actually drawing it as a linear process, but as we went through this, the co-designers realized they didn't want it to be linear. They wanted users to feel they could jump around to different action items and enter the process at different points. So we moved away from a linear roadmap. And you're going to see the final product of what this looks like in the tool in just a few slides. Once we had these drawings, we worked with developers to build a prototype of our planner. And after that, we conducted usability testing with 11 end users, about half of which were academics and half of which were practitioners who had never seen the tool before. And then we did test it with 5 quote experts. So those people were a little more familiar with D&I. After we conducted usability testing, we used a Think Aloud protocol, and we also did a survey called the System Usability Score. And in this, we asked users to kind of use the web tool on their computer, sharing their screen with us so we could all see what they were doing in the tool. And also they were giving us verbal feedback as they were doing it. So we gave them specific tasks they were trying to complete in the tool, and we were able to see how easy it was for them to do that, what they liked and what didn't like about it as they're going through it. So these tasks could be anything from just logging into the tool and creating an account, setting up a project, or actually doing certain tasks or what we call action items in the tool. So overall, users really liked the look and feel of the tool. They liked the content of the tool. They felt like it was action-oriented and things that are not often considered in planning for dissemination and sustainability. But we actually got a pretty low score on usability. So we had a 66, which is poor usability. And what we found is that users felt there was just too many words on the screen. So one of our biggest challenges was how can we provide enough information to the user with not overburdening them? But they also felt like they didn't really know where to go, how to begin, how to get started, or what to do. So some of the major changes we made were we added instructional videos, we have a guided tour on the website, and we reduced the text, simplified language. We really simplified our project setup and login. And then we actually, from this process, ended up adding a whole new action item, which you'll see in just a bit. So now for the tool. So this is the home page. There are 2 key components of this tool. There's an education hub, and then there's the action planner. The Education Hub is available to anyone without logging in. So it includes general resources and resources relevant to different parts of the planner. So you can filter those or search for any resource you would like. You can find things like case examples, you can find methods. We have some example grant sections in there, and a lot of just linking out to other papers or websites that exist and are available. So the action planner is the other major component. This is the interactive platform of the D4DS tool. This is where you log in, you create an account, and you can add your team members to a specific project to work on in the D4DS planner. So when you're setting up your project, you create a questionnaire basically about what is the product you are trying to disseminate and sustain. And then you answer another key set of questions just about like your project budget and what's the main problem you're trying to solve. And then you invite team members to collaborate with you on your project. Some key features of the tool, which I mentioned a little bit already, came from our usability testing, are once you enter the tool, there's a guided tour on what each feature is. We have videos that orient you to the main page and each page that you visit. We have action items, and that's where you'll see the interactive activities. There are features where you can actually assign team members different tasks. So the tool was built to allow you to work maybe in real time or asynchronously as a team. There's also chat features where you can chat with your team within the tool, and everything you put into the tool is saved and can be downloaded out of the tool at any time as your what we call the D4DS action plan. So the key action items you would walk through as a team are identifying partners, you're empathizing and outlining the problem. You think about what is the context of your project. You think about how can you co-design your product, developing a dissemination plan, planning for sustainability, and then evaluating iteratively. Are you guys seeing my screen okay? Okay, there you go. All right, so each action item has an introductory video, then it has an interactive activity. It has what we call cue to equity, which I'm going to talk about in just a minute. And then at the end, it has a dive deeper section where we give you specific key resources for that activity to help you learn more. And then we evaluate your completion of the action item. Okay. So we realize that health equity can only be realized if the D4DS process is conducted with equity principles in mind. And that's why we include these cue to equity prompts that get users thinking about how to perform the action item with equity, intention, and focus. So these include things like we talked about earlier, consider who is present and perhaps most importantly, who is absent from your team. Be attentive on how you're asking questions, attend to power issues and implicit and explicit assumptions about the questions you're asking. Think about ways that you can share information that reflect values and cultures of your partners. So those are just a few examples. Each cue to equity is relevant to the activity that the team is conducting within that action item. And then we provide further educational materials that help them kind of operationalize the cue. So now I'm going to try to make this a little bit more concrete for you by giving you a case example of how you might use the D4DS planner. This is specific to a digital health tool, which is my own, called the Prevent tool. And so when you set up a project, like I said, you're identifying what is the product you're trying to disseminate and sustain. So in this case, it is a digital health intervention. You have to identify what health problem you're trying to solve. And then you input things like your project budget or other details that may drive decisions about what's feasible for your team to do. So if your project budget is small, you're not going to be able to have 10 dissemination strategies. You may need to prioritize down to a fewer number, for example. So the first action item is identify partners. And this should look pretty familiar because it uses the 7 Ps framework and asks your team to brainstorm partners in different categories. Think diversely about who you may include. So you're actually brainstorming and adding these people into the tool. And then as a team, you're prioritizing who are the most important people or who can you feasibly engage in this process. So you can email these partners directly to invite them to log into the tool and participate with you in this D4DS process. So you may choose to involve them as little or as much as you want. So they could come in and just do one action item with you, or they could collaborate with you throughout all of the action items. Sorry, my screen is not advancing. There we go. So second, another action item is we move to empathize and outline the problem. And this is really where we want to engage these partners to understand what they care about. So are you solving a problem that's important to them? Are you addressing barriers that they face in promoting that health or solving the health problem you're focusing on? What are their goals in solving the health problem? So that's really the goal here. So this interactive activity, you can email survey questions to partners, or you could answer them in real time with them in this activity. But really, we're trying to ask them questions about how would they describe the problem? What is their role in solving the problem? What are the main things they're trying to achieve, and what are the barriers they're facing, or in what ways are they failing to accomplish their goals? So the tool then uses AI to analyze these responses into 3 categories. So it has goals, barriers, and the problem. And so it summarizes their responses for you into potential items that you may focus on for your product. So as a team, again, you prioritize what things are you addressing with your product. And then the ultimate part or kind of product of this action item is what we call a value proposition statement. So the tool uses those, what you prioritized, uses natural language processing to recommend a value proposition statement that you can, of course, edit. But basically, this is a way of clearly communicating the value of your product. This can be used to communicate the value to your partners, maybe to funders, in presentations about your work. So this is just one example. So this reads, our digital health platform helps healthcare professionals who want to provide personalized health behavior counseling and motivate patients by addressing lack of information and enabling effective follow-up. This digital health platform is innovative because it adds the delivery of community resources into health behavior counseling. So that's just one example of what a value proposition looks like. I'll also show you the confirm and co-design your product step. And this really focuses on helping your team select a co-design method for your product. So you can see technology is selected here because that is the focus of this project, the Prevent tool technology. And then the tool recommends different co-design methods based on your product type. So in this case, we selected to use human-centered design. And then it takes you through an interactive planning activity where you as a team would generate a plan on how you're going to use human-centered design in your project. A really big action item in this is developing dissemination plan. So this is one of our most robust action items in the tool. So it starts with having your team brainstorm lots of different ways you may disseminate or share about your product. So when you create a new dissemination product in the tool, the first question is, who are you trying to reach? So in this case, in this example, we put practitioners. And then we specified that it was physicians, nurse practitioners, or physician's assistant. The tool then recommends certain dissemination methods that we know are most likely to reach that audience. Of course, these lists aren't fully comprehensive because we don't have all that evidence out there, but you can add another type of dissemination method that you think would reach that audience if you'd like. Once your team brainstorms all the possible ways they're trying to reach different audiences, again, you're working to prioritize which ones are most feasible and which ones may be most impactful, meaning which ones are going to reach who you're trying to reach or achieve your dissemination goal. And you can vote to do that. So your team, you can see these little plus or thumbs up signs. So your team can vote on which ones they think are most feasible and most impactful. Or you could do this in real time in a meeting. You drag and drop these things into the different categories of, yes, absolutely, we want to do this, or maybe we do, or no, this isn't feasible for our project. And then from here, the things that you select, you create a plan on how you're going to share them, adding things like, when you're going to share it, who's going to generate the product, what the budget may look like. So those types of planning details. So those were just 3 of the action items. I don't have time to go through all of them, but I want to just give a few tips for how, for using the planner. So I think the first tip is just familiarizing yourself with the tool before you engage partners. This tool is pretty complex. There are a lot of different action items in it. There's some really, what I think are neat features like using AI and natural language processing that help you, but it's important that I think you understand what the tool can and can't do before you bring in your community partners. All the features are meant to be collaborative. So this really functions best if you're using it as a team. And we really want you to encourage you to use it along with your partners. And it's meant to be an iterative process. So we don't expect that you go to one action item and never return to it. In fact, we hope that you return to the action item and improve it as you learn from a subsequent action item. And I would just say, give yourself time to use it. So this is not meant to be a tool that you log into once and complete everything. Rather, we kind of expect that you use this over time and return to it. And so that is why everything you put into the tool is saved for you automatically in the tool. So you'll never lose your work and you can return to it whenever you like. So some of our key kind of next steps are, of course, right now we are actively disseminating this tool. So we launched the tool in December at the annual Dissemination and Implementation Science Conference. So this is newly released. And so one thing we're trying to do is just get some real use cases of the tool. So if you are interested in using the tool or you start to use the tool with your team, we'd love to hear from you because we want some real case examples of how this tool worked for you and what was helpful. We're also hoping to do a pragmatic trial, kind of testing whether or not facilitated use by our team versus teams who just pick up and use this tool independently is the best approach. Yeah, and I'm happy to take any questions that you guys have. And if you don't have questions for me, I have questions for you. So thanks so much for being here.